That was not very convincing in this angiography, number one. Number two, if you are saying that there could be endothelial dysfunction because of dengue virus infection, that could lead to acute Ghani syndrome. So there is a possibility that there
Sir,
was.
this is the as sir we couldn't define or diagnose SCAD at the very beginning. The SCAD is basically a retrospective diagnosis most of the time. When the
It's
angiography
just a guess. It's just a guess, and you can make a guess of acute Ghani syndrome as well, because there could be a thrombus formation leading to this haziness in LAD, and as this LAD was wrapped around and supplying the inferior surface, so there was ST elevation in the inferior leads, but there were no changes in the anterior chest leads.
And sir, probably maybe there were transient elevation in the interior leads, but we couldn't get that because we have only that one
I
ECG,
think
sir.
the views of RCA were not taken. RCA was not studied well and proper. There
Sir,
was
I
only
have views.
single view, and you cannot
Sir,
say
I have
anything about
views
the
in
distal.
in my mobile. Sir, I have views in my mobile, but the
Anyway,
presentation time was
this
short.
could be a possibility, but the evidence is not enough to convincingly say that.
In any case,
What type of evidence?
in any
should I
case,
bring?
जैसे जनरल साहब ने कहा है कि there are only two possibilities. One is acute coronary syndrome, and the other is that there was inflammation in that segment of the LED due to whatever infection you may have. So I think these are very interesting things that we have to keep our minds open all the time. Anything can happen. These viral infections, bacterial infections can affect coronary arteries.
Sir, similar case reports have been published which associates
And
the
the
dengue
way it
with the
has
scales.
cleared, my guess is that probably it was an acute coronary syndrome. The clot was dissolved and it has come back because there was a regional wall motion abnormality. It means there was a little transient damage to the myocardium at that time, which was restored. So anyhow,
Sir, actually the
सबसे
SCAD can
अच्छी
be.
बात यह है कि सेदू में we have got cath laboratories, not one, more than one, and angiographies are being done there. There was a time that even ECG could not be done there, and now the
Yes,
progress. So very well done. वहाँ भी डॉक्टर हिफ्जुर रहमान साहब है ना?
Yes, sir.
So I frequently go and visit.
We appreciate your effort and especially your index of suspicion.
So
Thank you, sir.
well done. Thank you.